processes related to medical services provided to the inmates. Number one, the passing of medications to these inmates. Number two, the processing of inmate sick call, health requests, and last, third, the adjudication of inmate grievances. On a limited test basis, we selected a sample to determine if CCS was providing services on a timely basis and in accordance with the contract provisions.
So if I could just add to that, the three processes we looked here were one of the concerns that the Chief Judge had as far as a consent agreement, so we wanted to include these three processes into our procedures.
Okay. And for our third objective, we performed additional procedures, including assessing whether health HVCW monitoring of the services was being performed, including the payment of services. Okay, our fieldwork procedures focus primarily on operations in the 3 Wayne County jails. We did encounter some difficulties during this engagement. In order to assess CCS's adequate provision of these contractually obligated services, we initially requested on April 24th of 2018 a listing of completed inmate grievance forms as part of our initial review. Completed forms were provided to us on May 11th of 2018, but they were so heavily redacted due to HIPAA restrictions that we could not make an assessment of these. We made subsequent requests to review records related to both the passing of medications to inmates as well as inmate sick call requests. These were also denied. As a result of our request, management was in discussions with Corporation Counsel. On December 4th of last year, Corporation Counsel opined that we could not gain access to inmate-specific information. This decision was reconfirmed on February 5th of this year. Finally, on June 27, 2019, Corporation Counsel stated that limited access could be provided to our office if we provided CCS with a letter requesting release of certain protected inmate information. We provided this letter, and a limited review was performed of the passing of medications, inmate sick calls, and inmate grievances.
I just wanted to add, regarding this delay that we had is receiving the HIPAA information, the protected information. This was important for our engagement because we needed to be able to look at the inmates' medical records to ensure that medications was being passed, what type of service was being provided. It took a lot of effort on the behalf. I think the Commission Chair was involved, Commission Counsel on our behalf was involved, Corporation Counsel worked with David Brooks. So finally, in July of 2019, we're finally able to get access to this information that we believe was vital for our review. But it was a lengthy delay not being able to get access initially.
In quality of care, evaluating the quality of the health care provided to the inmates was beyond our audit scope. So we expressed no opinion on that, on the quality of the care, since we don't have the medical expertise to assess the quality of care provided. We did review the process implemented to monitor the quality of care, along with performing on a limited test basis the timeliness of the care provided.
This is important to add to on the quality of care. And, as far as our audit, we're looking at process and controls in place. We're not able to determine if the right medical service was provided to an inmate or if they were getting the right medication, one formula over another formula. That's beyond our expertise. But we're relying on the county's oversight and the healthcare administrator and everybody within the organization to make sure the processes are correct. So we looked at that part of it.
Clinical Services Jail Health Services Program is a division within the department, and they provide physical, mental, and support services to inmates in the 3 Wayne County jails. On October 20th, 2016, the Commission approved a 33-month contract with CCS, not to exceed approximately $52.5 million, to provide a comprehensive quality of health care program for jail inmates. So the contract began January 1, 2017, hence the 33-month period. It's a cost-plus management fee agreement whereby all operational costs of CCS are passed to the county. There's a pricing guarantee so that if any contract year the total pass-through costs exceeded the budgeted amount, CCS and the county would share equally in the excess of the cost up to $500,000 per contract year. If the costs were less than budget, each party would share equally in savings up to $250,000. Now, if the costs exceeded or fell below these thresholds, the county was totally responsible for the excess of the costs incurred or would receive 100% of the savings involved. There was also contract provisions regarding the adequacy and consistent staffing levels, an implementation of an electronic medical record system, and submission for accreditation of the jail facilities within 18 months of the start of the contract.
If I could add too, and I hope you don't mind if I.
No.
Page 6 through page 8 of the contract, we have the report, we have a lot of background information. We include a table that shows what the $52.5 million makes up, how much is jail medical, how much is jail mental health, and mental health service for JDF and clinical services. So we tried to put a lot of background information into the report, the actual report.
We appreciate that. Commissioner Webb has a question.
Thank you. So my first question is, is there currently a class action lawsuit that's going through the Department of Justice, or an investigation by the Department of Justice as far as it goes with the quality of care being given to the inmates?
We'll let the department.
I'll speak to that, assuming no one is here from Corp Counsel. It's not a lawsuit. There is an investigation that's happening through the U.S. Attorney's Office, yes.
Okay, I thought so, because in government ops, I thought we were paying Mike Cox's firm to represent us in providing information to defend our position against those throughout that investigation. So, if outsourcing the provision of jail medical services to CCS was estimated to cost the county an additional $1.5 million in the first year and $2.2 million in the second year, why did the actual costs come in under budget by $1.4 million and $2.2 million respectively? And then, are they providing the services, per the contractual levels? Because basically that is the claim in the lawsuit.
And we're going to get into that in a couple more slides. We get into the actual.
Okay, okay, well, I can hold that. You started.
Do you want to respond now to that question? Sure.
I'd probably take Marcella's lead on letting you bring forward the analysis, and then we can respond to it.
Oh, okay, that's fine.
It may answer some of your questions as well.
Okay.
Whichever way, but.
Okay.
Okay, and then Commissioner Dobb has a question.
Thank you, Mr. Chair. So you stated that the scope of the audit is not on the quality of care, and that a lot of this stuff is protected by HIPAA laws. How can we look at the quality of care and what is protected by HIPAA laws? Are there auditing firms that we can contract with that maybe do you have medical professionals that can look at that for us?
Good question.
There would be a possibility that you could hire an outside medical doctor, something that has the medical expertise. But I think what we can rely upon is the KPIs, the key performance measures that have been put in place within the contract that looks at the actual medical care that's being performed and making sure that the county is providing the oversight over those KPIs, make sure they're being addressed, make sure we have the right KPI performance indicators in place. That's one way you could do it, other than going outside and getting possibly a doctor, somebody to come in. To.
Some commissioners may or may not know what a KPI
I'm sorry.
is.
Okay.
A key performance indicator.
Okay, thank you.
Thank you.
Thank you. Is that answer questions answered? Okay.
Yeah,
please proceed.
We can skip to that.
Okay. Our first objective was to assess the cost of the county for contracting the jail medical and mental health services. Our conclusion is that at the time the contract was approved, it was estimated the additional cost of the county for the first year would be approximately $1.3 million and $1.5 million for the second year, respectively. CCS, however, came in under its budgeted cost by $1.4 million and $2.2 million for fiscal years 2017 and 18, respectively, in the adult facilities. This next chart shows the total expenditures related to jail medical and jail mental health services recorded in the county general ledger for the respective years. Fiscal year 2016 should be noted. This is when the county performed all the services in the jail. And then for the first 3 months of fiscal 17, we performed them. Last 9 months of fiscal 17 and going forward, CCS provided those services.
And this chart, too, also includes all the expenditures recorded within the business unit for the jail medical and the jail mental health. And we only use these two, the adult, for comparison purposes, because we wanted to show back in 16 when we had chargebacks and all the charges from the county, then compare that to what is recorded in 17, which was the 3 months and the 9 months, then 18 when it was all provided by CCS. So you may have a small number of other expenditures, but the primary expenditures would have been the contractual services with the vendor. So that's why we only use the two adult, because the other's only a small amount. Just in comparison purposes, so that you got everything in 16 when it was county comparative. A good way to look at it would be 18 when everything was CCS, and you got two comparative purposes for those two business units.
Commissioner Webb?
Okay, so now we're at
Yeah.
the point where you can answer my questions as it relates to service delivery. Are you delivering all the contractual levels to the contractual levels and still incurring the savings, or do you have these 1.4 and $2.2 million savings because we're not providing the contractual level of services, which is the claim and led to the investigation?
Right. Yeah, I'll speak to the first question, and then Kamal, you can probably speak to the second one, because that involves more the actual to the budget issue.
Correct.
On the first question regarding overall performance, and we'll see more of that later when we talk about the key performance indicators and other results, I think we are getting the service overall that we're expecting to get. There's room for improvement. We'll talk about that as we go through the detail. But I think we are overall getting the service. A great indicator to me, Commissioner Dobb, to your earlier question as well, is that we've had our first ever external organization accreditation of JO Health, the National Committee for Correctional Healthcare. Something like that, National Commission, which is an outside organization. I'm a hospital guy, as most of you know. It's similar to the Joint Commission that you've probably heard of at times that accredits hospitals. It's a similar type organization, obviously focused on JO healthcare. First ever accreditation happened earlier this year, and we received an accreditation as part of that. That's an objective body. They come in, Commissioner Dobb, with physicians and psychiatrists and other clinicians as part of their full week review. So they bring in the experts, the clinical, technical, and other experts. They're obviously much less focused, if any, on the business side, as our auditor would be more focused on through this report. So that also is a positive indicator, an objective source that has come in and granted us our first ever accreditation, thanks to a lot of hard work from the professionals involved. Again, we'll get more of the detail when we talk about the key performance indicators and things like that later in the report. But overall, that gives me confidence that we're in at least a positive position in the sense of performance. We can do better. We'll talk more about that. Now, on the budget issue, that's a little different. I'll let Kamal speak to that, if that's okay.
Yeah, absolutely.
Kamal Keparu, Finance Director. Initially, you all know this was a new project, so I think the concept or the philosophy was to make sure we had enough money, because it was too many unknown elements. And as you look at the data, we had the first 9 months and had to work out a lot of different bugs. But if you look at the second year, stuff got smoother, but it still was a surplus. Now, the third year, you will see that the numbers are a little closer. So your surplus started going away. But the initial, to answer your question directly, it was just too many unknowns. So the concept was just to make sure we had enough money in there.
So do you think that they, I mean, I get the learning curve because it was a huge change. We did business one way for a long time, and then we were changing the way we did the business, and there was a total bunch of unknowns because we didn't know how this company would actually perform once they got in. I mean, you hear what they say, but until they're doing it, you can't really evaluate it. Then is it your, I guess this is kind of a combined question because you're the numbers guy, Kamal, and you're the operations folks over here. So is it your personal feeling that the complaint then is unfounded and that we should have no problem responding to that investigation based on what you're seeing as far as service delivery? I mean, do you have several inmate complaints, or do you think that you're handling it?
I'll give a first answer, and then I would like Dr. Keith to be able to respond to it because he's obviously got the technical and the clinical expertise. Again, I think overall the best indicator to me is the outside organization that was brought in that does this for a living, which is the NCCHC. And they were very comprehensive and very detailed and came back with a report that said, overall, you guys are doing good. Here are some areas for improvement. And I think there will always be areas for improvement. U.S. Attorney or anybody else coming in from the outside looking, no doubt will find things we can improve on. So I can't say that I expect them over time not to come back to us with areas for improvement. It's unrealistic to think that. So I think they will, but I don't know how and when that will occur. I think we'll respond to each and every one of them and put, if we agree with the validity of any criticism on something that can improve, our job then is to improve it and to demonstrate that we've improved that.
But do you think it's just part of the learning curve? I mean, do you think it's part of the new people coming in, just figuring out, what the needs are and organizationally getting it together to be able to deliver those services? So it's not like it's not like they don't know.
Right.
It's just a matter of implementation of a big change.
Let Dr. I wasn't, obviously,
Yeah.
I'm relatively new, so I wasn't here during that transition period.
And he's been with us forever,
Right. I
so.
mean, that's probably a great one for Dr. Keith to respond to.
Again, Keith Dugo.
It takes a second.
There you go.
Good morning, Keith Dugokensky, Correctional Healthcare Administrator. First of all, I agree with, what David said in terms of this outside agency coming in, the National Commission on Correctional Healthcare being a good barometer as to how it is that CCS WellPath is performing. They came in 3 days, brought in all their experts, medical, mental health, nursing staff, and took a look at operational and clinical services. And the end result of that was, in fact, that they gave the Wayne County Jail, through the department, accreditation for a correctional health care facility, meaning that we are delivering services consistent with what are national standards. And as Dave said, this is a first accreditation for the jail facility of any kind, any type. And I'm pretty confident in saying that without CCS and WellPath, we probably wouldn't have got there. There is room for improvement. With regard to the DOJ, like was already expressed, they are going to find some areas that we do need to improve on. We still have a couple corrective actions with regard to the NCCHC. Some of those overlap, actually, with what it is that the DOJ has expressed concern about. We have a group that includes the county team and the WellPath team that are working on those corrective actions now for both entities. More for the DOJ, it's at the point of production and producing documents. At the NCCHC, there are a few things that we need to turn in that sort of final stamps our accreditation, albeit we have it. With regard to the overall performance, it's, I think like Marcella said, been the county's position that we will ongoing, daily, weekly review overall clinical services through the key performance indicator structure that was built in cooperation with CCS WellPath. That was part of their contract service level agreement requirement that was put together in the contract. We've developed 23 KPIs which measure very specific clinical services. And those are collected on a daily, weekly basis throughout the course of the year. They are calculated monthly, and then they are reported to the department on a quarterly basis. And we review those against threshold standards of care, and they really are the best barometer. And it is our obligation and responsibility as the county and the department to make sure that they're hitting targets and doing what it is that needs to be done on that clinical platform.
I appreciate your answer. I just want to respond to it really quickly. The reason that there was major concern especially for new commissioners, is because we went from an in-house union-operated county employees providing jail health care to a for-profit company, frankly, out-of-state, non-union, for-profit company, to come in here and provide those services, and then they actually, as part of the deal, offered the county a portion of cost savings, which would, what concern, our big concerns that had, and Tim Colleen was very vocal in this discussion as well. It's unfortunate he's not here, but it is your desire to save costs going to compromise quality of care? And so that was our big concern with this. And then when you got the investigation going on with the Department of Justice, so I'm glad to hear that you got your certification, because I think that's a good rebuttal to the questions being posed in the investigation. I just wanted to hear, your position on it. I'm glad to hear you got a corrective action plan from them, so that targets, audits educate us all. And so specifically where you need to improve. I think that'll help you operationally. So, okay, I just wanted to hear from your side of the story, because I deal with the lawsuit in my committee. Thank you. Or the
Absolutely. If I could make
investigation.
two quick clarifications, if I could.
Okay,
very
briefly,
quick.
thank you.
Yeah. One, CCS, now called WellPath, honored the 2 union contracts and are still active in force. So the staff at the jail
that's good.
are still members of either GAA or AFSCME as part of, with a contract with WellPath, or CCS WellPath now. So they did honor that as part of the transition, and that's still in force. Right, so that's, just to clarify that. And then second, it's a cost-plus contract with WellPath. So therefore, they really do not have any short-term incentive to save costs. We want them to act responsibly, but they don't receive significant rewards, economic rewards. It's a cost-plus contract. Now, that's going to point out some other challenges in the audit that we've had on our end, not recognizing that and putting systems in place to monitor that expenditure of cost. But it was purposely done this way to be at the time, I wasn't here, but I respect it in hindsight, to make sure there is no adverse incentives set up to reduce costs and therefore reduce quality of care or service by the vendor.
Well, I'm glad that those things were addressed. Okay, thank you.
Ms. Corral?
I just wanted to add too, regarding the KPIs that we're talking about later on in the report, we talked about some processes, recommendation we had in processes, they're going to be put in place to strengthen the KPIs. We'll talk about that later too.
Okay, thank you. Please proceed, Mike.
Okay, next issue, Correct Care Solutions invoices lack supporting documentation. This is on pages 12 to 16 of the report. For the 9-month contract period, January 1, 17 through September 30th, 2017, the total CCS budget was about $14.3 million, which included $107,500 for initial startup costs and then $1.4 million in management fees. Per the contract, CCS invoiced the county 1/9 of the budgeted fees, less the startup costs, monthly for an amount of about $1.5 million, which included $158,000 for management fees. For the first full fiscal year of the contract, October 1, 17 through September 30th, 2018, total CCS budget was about $19.1 million, included a monthly management fee of about $1.88 million. Per the contract, CCS invoiced the county 1/12 of the budgeted fees monthly for about $1.5 million, which included $156,000 for management fees. We confirm that CCS did invoice the county, and the county did pay these amounts for both contractual periods. Now, the contract provided for a reconciliation process. So per the contract, there was a required annual reconciliation to be completed on or before September 8th of each fiscal year. However, we noted that CCS provided quarterly reconciliations, which are more advantageous to the county. We did confirm that for both periods, a reconciliation of the calculations for savings were correct based on the contract language. Costs less than or more than budget, both the county and CCS share up to $500,000. It's $250,000 each. Any costs or savings above the $500,000 is either the county's expense totally or the county receives 100% of these savings. After numerous requests from our office, we confirmed that the county did not request from CCS any documentation in order to validate the billed costs, for instance, such as payroll registers.
Something I wanted to add here, when we say that we believe that the quarterly reconciliation is more advantageous to the county, while the contract required a true-up at the end of each fiscal year, we believe, in our opinion, that by doing a quarterly true-up, the county has a more real-time understanding of what the actual costs are to the county, so that they need to adjust or look at to why something may be over, rather than wait until the end of the year. So we believe, even though contract required September 8th, they are doing it quarterly, and we believe that is a better.
This brings us to our first recommendation, number 2018-01, which is classified as a material weakness. We recommend the department management implement procedures to ensure the validation of the actual costs that are submitted by CCS. Management's response is pages 15 and 16 in the report.
So if I can explain this one a little bit more detail, what happens is, for the first 9 months of the contract, or the 12-month contract, the county pays the vendor 1/9 of whatever the budget was. So every month, the same amount of money is going to the vendor. Then when they were doing their quarterly reconciliations, an invoice would be submitted to the county showing what they said was their actual cost, and then they would determine what the true-up was. Our recommendation is, what we talked to the administration, was that we're not doing anything on the county's behalf to determine what those actual costs really are. Even though we say $1.2 million in the first contract, what the services that are being performed, what we're paying for, what is actually the true cost. If there's no validation of payroll cost or pharmacy costs, we need to know, to have some confidence in the invoices that's being submitted for actual costs, what they truly are. And I believe they may respond
So going
to that.
forward, there's going to be quarterly reconciliations? Is that agreed to? Somebody?
I'll jump in first,
Sure.
Mo. Yes, and I think we're doing that right now, the quarterly reconciliation model. What we're not doing, and this is going to be a theme throughout, we haven't done a good job with, and we have put systems in place since the dialogue with the OAG, and obviously it'll be part of our corrective action plan, is we are not verifying the invoices that we're receiving with actual direct data, copies of receipts, except copies of purchase orders by the vendor, et cetera. That was our oversight. I think it was a misunderstanding of the overall structure of a cost-plus contract, and with that, we've now understood it as part of this process, and we're putting procedures in place. And again, that will come up in a number of these items.
So going forward, there'll be quarterly reconciliations, correct?
Well, correct, yes, to answer your question directly, and to piggyback on what the OAG officer Marcella said, is that for the first 9 months, or at least the first 9 months in a year, I was directly involved in working with CCS. We did establish a relationship, or I established a relationship with their finance person, and we established the quarterly. We pushed that, but actually we look at them every month. So each month we go through the financial reports, but to Mr. Brooks' point, now we would just have to request the actual receipts and invoices. So to answer your question, we look at it on a monthly basis.
Okay, but if something ever happened that you left, I want to make sure that it's in place that we do it at least quarterly.
Yes.
Ms. Cora?
And the reason why we're saying this too, because from an audit perspective, cost-plus contract, the vendor is going to bill us all their costs. We want to make sure from our perspective that, the nurses that are working the jail, we're actually paying for nurses that are working in Wayne County jails and not working in Macomb County jails, that the pharmaceutical costs are pharmaceuticals coming to the Wayne County jail, not maybe a Macomb County jail, then what we're actually getting is what we're paying for, and we believe it's an important step to put in place some kind of process, so there's some type of validation with supporting documentation.
Thank you.
Can I add more?
Sure.
And this was new to CCS too. So once we talk with CCS, they have to change their structure. Now, this is something they have to do, but their accounting system wasn't set up to provide us with data, meaning we get a spreadsheet from them each month, and you just see the different numbers. So it may say 5,000 for supplies, right? So when I asked them for detail just for us, they had to do whatever they needed to do, and it took time. But now their accounting office is working on how to segregate just Wayne County data and give invoices.
Thank you. Please proceed. Mike.
Next item is lack of detailed supporting documentation for the startup costs, pages 16 and 17 in the report. The contract allowed CCS to bill non-recurring startup costs for the initial year of the contract in an amount not to exceed $107,500. CCS did bill the county for the $107,500. There was two separate pieces to the billing. One was $46,000 for salaries, and then another $61,000 of the total $109,000 incurred by CCS for travel and lodging costs. As costs were detailed in two separate spreadsheets provided by CCS. One was for the salaries, the other one was for the travel and lodging costs. Again, this was $109,000 incurred by CCS. They only billed $61,000 of that to get to the total of $107,500. We looked at the spreadsheets. We could not determine what items listed in the travel and lodging spreadsheet were actually included in the $61,000 that was billed to the county. Some items in the spreadsheet appeared unusual, including $2,500 billed for a business meal with attendees on December 31st, 2016, which is New Year's Eve. There's another $5,000 for airfare for one employee, which included 7 trips during 1 week in December 2016, and then charges for other items like incidentals and tips/gratuities. We did not request from CCS any documents in order to validate the billed startup costs.
Ms. Cora?
If I could just add to that, we're not saying that there's anything wrong with these charges that are here. You know, I believe talking to Brian Main, there was something that took place but these are things from an audit perspective. When we look at a spreadsheet of costs, they were questionable to us, and that's why we believe because they're questionable to us, they should be questionable to the county, and that's when the county should be requesting documentation to support to show that these are actually true expenditures to the county. These are just some examples of things why you should get supporting documentation.
Would somebody like to respond, County?
Yeah, I will. It's the same theme. We trusted the overall invoice from CCS when they submitted it to us. Not saying that's a bad thing to have trusted it, but we never asked for any backup evidence of receipts or specifics. So we have now since done that. Kamau has asked them all the way back to the startup costs. So you're talking almost 3 years ago. Randomly selected certain parts of the invoice. They have provided or will be providing the actual copies of receipts, and he will verify, or his department will verify that the expenses match the overall invoice. We'll also look at the items that are listed here as unusual items. If they do not end up being part of Kamau's randomly selected amounts, we'll specifically ask for those as well and make sure that they all seem appropriate with the direct evidence to the invoice.
Can I add a little more?
I'm sorry. Commissioner Webb, want to jump in there?
Yeah, I'm just, as a policy question, I've got to ask about these. I mean, $2,500 for a business meal on New Year's Eve, is that over $5,000 for a person traveling? Incidentals and gratuities, are these things that are part of an agreement with this organization that these are, qualified expenditures? That it's okay to give us a bill for $2,500 for a New Year's Eve party?
We'll confirm each and every item that it was appropriate. Remember and again, Kamau or Keith can speak to it as they were here. My understanding is there was a team of somewhere between 20 and 30 people here on New Year's Eve. They went out to dinner on New Year's Eve, and the cost per individual, because that's a combined receipt for all of them, does not seem excessive, but we will be confirming that.
My thing is not so much as the cost being excessive, is the cost being billable to the county is my issue. I mean, that's, to me, from a policy standpoint.
I think the OAG you guys should respond to that.
I got several people lined up here. I'm taking notes. So Kamal's next.
Well, I was just going to add that we have reached out to CCS on these particular items so we can get the support to make sure. But also I wanted to talk about what we did was, and I worked with the OAG office on coming up with a method to review the invoices because, again, on a monthly basis, that's a lot. We won't look at every invoice, so I think we picked about 10%. And out of these items, none of these were in my first sample, so I did contact CCS and say they'd be getting back with us in reference to these particular items. So I'll get that clarity.
Okay, Mike?
I just want to add the startup costs, the language is very vague in the contract as to what constituted a startup cost to begin with. I should note that none of the costs billed by CCS were incurred prior to the approval of the contract. The $61,000 that was billed for the travel and lodging, again, the items that we noted as questionable were included in the total $109,000 on the spreadsheet. How much of those were actually comprised of $61,000, we don't know. That was billed in addition to the salaries.
And Marcy?
But to add to that point, the startup costs, especially that included all the startup costs, there was a great deal of travel and meals.
Correct.
So that'd be for the individuals coming from outside to transition the jail over to CCS. So that was part of the startup cost. I'd say it's primarily travel and meals.
Okay, back to Commissioner Webb.
Thank you. And they're documented in our agreement that the county is going to bear the costs of these expenditures. That's, I mean, if we told them, hey, you can do this, then that's on us. But this seems, to me,
That's
way
what we're saying, the
outside.
contract is very vague, it just talks about startup costs. This is what we're saying, when we requested the invoice, what was included in startup costs, this is where we got the spreadsheet that included the travel and the meals and things like that. Whether we believe they're appropriate or not, there's no documentation, so we don't even know what they're for.
Commissioner Bell?
Okay, thank you.
Thank you. To that point, you said it was vague with the language.
Yes.
So that means that they didn't have a particular up to amount
It
in
was
the
up,
language?
it was up to 107,500. They did spend more on startup, but they could only bill the county up to 107,500.
Correct.
And they did the 107, obviously.
Yeah, had a party and everything else.
Okay, but okay, that's what I'm wondering, what the up to account.
Yeah.
Okay.
Yeah, that was.
Mike, please proceed.
Well, gotta-
Oh, I'm sorry, Doctor.
Yeah, and again, just to add for clarification, and I think, Mr. Brooks identified this, but I think it's worth reiterating. It is pretty standard when you're transitioning a large institution like this, that not only do you have your staff in place at go time to man all of the required duty stations, but you do bring in a significant team of additional staff for the week prior, certainly the days prior, and a week, 2-3 days after, however long that is, to make sure that this transition is occurring in a way that it needs to occur. And clearly, CCS WellPath had a large team, 20, 25 people that were here during the course of that handoff. I was part of that handoff. They were here on site. People were flying in and out of town, as would be required to make sure the transition, occurred as smoothly as possible.
Okay, thank you. Mike?
This is just a recommendation, 2018 skip that. It's the same recommendation as the other costs. Okay, moving on. No support for staff costs, pages 18 and 19 in the report. Wages and benefits represented 61% of the total expenditures for the first 9 months of the contract, and then 60% of the fiscal year 2018 expenditures. A little chart shows the breakup there for total expenditures and the wages and benefits as a percentage of those expenditures. Again, the county did not request any supporting payroll registers or other type of documentation to support the wages and benefit costs. We just relied upon what they said were the costs. Because we were unable to validate the true personnel expenses with the actual costs, the county could possibly be paying CCS for staffing in the jails that does not represent actual services being performed in the jails. Recommendation 2018-03, material weakness. We recommend that the department implement procedures to ensure supporting documentation is requested and received. This will allow management to perform a reconciliation to ensure that the county is only paying for the services that were actually received.
And again, because salaries are representing over 60% of the total cost, it's important that we can able to show through documentation what our payroll costs are, and it could be accomplished through receiving payroll registers from CCS that the county can validate and compare that to the actual invoices. But we need to have something so we can have some confirmation of what the actual costs are. This is similar to the rest of the invoices too.
Our second objective was to assess the contractor's compliance with key contract provisions. We were able to confirm that CCS is in compliance with many of the key contract provisions, including the implementation of electronic medical record system, submission for accreditation, their staff is properly licensed, health screenings take place within 14 days of inmate intake, and there's a 30-day chronic care assessment for the inmates. However, we did identify some key contract provisions that were either not complied with or where compliance could be enhanced or improved. Again, the purpose of our engagement was to test compliance with certain key contract provisions. We don't have the medical expertise to assess either the quality or type of healthcare services provided or not provided. We couldn't determine if the proper medications were administered and prescribed. We relied on information provided to us by CCS and or confirmed in the inmates' electronic medical records.
I think this is important too, this statement that we relied upon the information that was recorded in the medical records, because we did sit down with the healthcare administrator when we were going through some of our test procedures, and she walked us through individual inmates' medical records to determine certain things took place, certain things didn't take place, but we had to rely upon what's in the medical records. That's the only thing we have ability to rely upon. So I just wanted to add that.
Based on what I'm hearing, basically is from the county and CCS, there was a transition period. It wasn't perfect. There are major improvements going forward and major accountability going forward. And a lot of these issues, management agrees with the auditor, general staff, and so we're all rowing together at this point, correct?
And that's what we're going to go through now.
Thank you.
Okay, next item, CCS actual timesheet queries were not always reliable, pages 20 to 22 in the report. Each month, CCS provides a summary report of budget to actual hours worked by their entire medical staff. Now, to reconcile the actual staffing hours to the summary report, our office requested actual timesheets for the period of October 29th, 2017 through November 25th, 2017. This coincided with a CCS time reporting period. It also included a Thanksgiving holiday time. We noted that the timesheet reported hours were significantly less than the hours reported on the CCS monthly report. First pass through, there appeared to be approximately 30 missing timesheets provided to us. We requested the query to be run again. It was, however, the 30 missing timesheets were included in this query, but an additional 34 timesheets that were included in the first submission were missing in this one. According to their contract, these monthly reports were supposed to be available for transparency purposes and would allow auditing down to the individual and shift level, which could be searched and queried. However, based on our review, their queries, CCS queries, were not always reliable. Therefore, we could not determine if the staff reports were accurate or the services were actually being performed.
Just to add to this, what this was is we wanted to get some comfort over what it is. CCS provides a monthly report to the county that shows their budgeted FTE hours and what their actual FTE hours was, and that's what they use for the purposes of determining whether they're meeting the requirement. So what we did is we took this 1 4-week period and we requested all the timesheets. Within that, when we received all the timesheets, we created a huge schedule where we put each employee's hours in to determine, if we've met the total requirement. As Mike said, on the first go-around, we were missing 30 timesheets. It appeared we were missing 30 timesheets because our hours were so far off. So we went to CCS in the department after several discussions. We finally got CCS. They ran the query again. When they gave us the second query, we covered the employees that weren't on the first run, but then we were missing some of our original employees that we had from our first. So we didn't have a comprehensive query that was run that showed all the employees that worked within this time frame so that we could calculate out the number of hours they actually worked. With any type of system, and I understand CCS indicated that they had 2 systems in place, so when we got the queries, they were pulling from 2 systems. But what the county needs to have is some reliability when they go to CCS and they want a whole complete query of all the individuals that were working within the Wayne County Jail within that period, that we're getting the actual query that only shows those employees and all the employees that are working for that period of time. This did take quite a bit of time, but I think it was very valid in our procedures so that we actually got to where we are today.
Commissioner Dobb.
Thank you. I have a couple questions. So you mentioned there are 2 timekeeping systems. Is there only one now? And is that Kronos?
Yes.
Okay, and can you describe to me how do employees punch in and out of work with the Kronos time system? And how do they request time off?
Master?
I think,
Let me take a shot at answering that, and if we need to bring Ms. Bedell up to the table from WellPath, we can go ahead and do that. So each facility is equipped with a swipe card that is individually specific. So individuals swipe in at the beginning of the day, They swipe out for lunch, they swipe back in for lunch, and they swipe out at the end of the day. So that is the essential structure, if you will, for recording an individual's time, and that is in all three of the Wayne County Jail building facilities. So you know when Joe and Sally actually came on board, when they left for lunch, when they came back, and when they left for the day. The issue with regard to being able to collect all this data very neatly was complicated in the past system where agency employees, i.e. not employees of WellPath, but they worked for an outside agency or nursing pool, were not consistently required to swipe in or swipe out of the system because they're not being paid by payroll. They're being paid by accounts payable because they're not employees. So the change effectively has been that now all agency employees are required to swipe in and swipe out just like CCS WellPath employees. So there is a single collected database that records all hours. And that change was actually pre the audit period that the OAG looked at.
Post the audit period.
I'm sorry, post the audit period. So that change is now in place. So all those hours are collected in a central database. Some of those employees are still paid by payroll, and some are still paid by agency, but we do have a collect database for the hours now.
So you took a pretty good swipe at it, so thank you. Did that answer your question?
Okay, yes, and then how do employees request paid time off?
I believe there's an electronic system that they use to put in a request, and it's approved by the management staff at the site level.
So they can log in to like a Chronos system and submit their requests?
That is correct.
Okay, and then is that the same for like salary? Are there salary employees that would do the same thing for their paid time off?
Yes, the same Chronos system is used for the hourly and the salaried employees.
All right, thank you.
Thank you. Ms. Cora?
And then our recommendation was that we need to ensure that CCS can provide accurate, comprehensive, and valid reports to support the staffing levels. So that's based on the queries. Now we're going to go into the next one. Based on this massive spreadsheet, based on all the timesheets, we did an analysis of the time and understanding that within this period was Thanksgiving and the day after Thanksgiving. So when we did our analysis of the employees' time, we noticed that we have productive time, which is actual services being performed in the jail. And then we also have what is non-productive time, which could be your vacation, your holiday, training, things like that, where you're not actually providing services. So we found, based on our review, that when an employee was working, let's do it this way, when an employee was not working in the jail for Thanksgiving, the day after Thanksgiving, that holiday time was being captured in the system as productive time, as if they were actually there. And then what we also found, the opposite was happening for those employees that actually went to the jail and worked on the holiday. Their hours working on that holiday was captured as non-productive time. So it was classified in the system as backwards. And what it was is we found that there was 1,216 hours that was captured as productive while no services were performed. And then there was 516 hours captured as non-productive when people actually were working in the jail, which the net effect was 699 hours of being recorded as productive time that wasn't. And they have identified the system, there was a system in the problem, and they indicated it's being corrected. So what we plan to do is when we do our corrective action plan, we'll ensure that when we pull one of our samples, that we pull a holiday to make sure the time was being classified correctly now.
So Commissioner Coleman?
Yeah, so the non-productive, which one, okay, the productive, do they receive time and a half for working holiday hours?
Yes, and that's going to be part of our next issue we have, too. We've had an issue with how that was captured also.
Because if they're not being classified properly, then some of them might be receiving time and a half when they really weren't entitled to time and a half.
Vice versa.
Right.
And vice versa, yeah.
Right. And what we looked at, the time, the actual time being recorded as hours correctly, but is how they were classifying the hours that got rolled up into meeting the contractual requirement. Per the contract, they're required to put in 103.6 of productive hours, then 15 hours was non-productive for a total FTEs of 118.6, and these are the hours that roll up to determine that. So with the misclassifying of the productive, it makes your productive hours higher than what they truly were.
Okay, so maybe the CCS, they weren't overpaying, but they might have been overcharging us.
Classifying the hours, yes.
Yes.
Classifying the hours.
Yes, okay.
Okay, and then Commissioner Webb, did you have a question?
No, thanks. We
Okay,
can move on.
all right.
I think she covered it.
And this is the recommendation was making sure we classify productive hours as time actually worked and non-productive, which kind of gets into what Commissioner Carcoma was. The next area we looked at, there was some individuals that may have been paid double time, because on the timesheets, it was, and I'm getting a little detail, it was classified as HOL, which means this could have been their double time hours, because they got paid for 8 hours and then 8 hours of bonus pay for the double time. But what the system was doing, it was classifying them additional 8 hours as productive hours, as if it was somebody actually in the jail working, rather than, as the money side of it, what they're being paid. What it was showing is they actually worked 16 hours rather than the 8 hours of actual work. So that was also being misclassified.
Follow up?
Well, sure.
Okay, so now, all of that's been rectified?
Based on the discussion with CCS, Mr. Brooks can confirm, they have fixed it into the system, but like I said, when we do our corrective action plan, we will make sure that we include a holiday in our test so that we can see that it actually is fixed.
And I can see how it might have been very confusing.
It was very confusing.
I would like to add, the issue here is less about the economics. Did we
Yes.
overpay them? This is more about, did they classify the hours properly as productive or non-productive?
Yeah, but
Either way, we need to pay them the
I was going to
hours.
say, but wouldn't that still impact the economics?
If someone was being classified to be paid double time or time and a half because of a holiday or overtime, and they didn't actually work that, absolutely. We have to do better with regards to having verification processes for the invoices on that. But that wasn't as much this
Right.
focus here. We didn't feel we discovered that as part of this
Right.
process. This was more, the contract looks to have productive, meaning they're on shift serving inmates clinically focused staffing. Anything not on shift is unproductive time, which we all have, vacation time, sick time, et cetera. We care the most about someone being there on shift to provide the care and service that's needed. So we focus the contract, again, this team did a good job with making sure that was a core part of this contract, to make sure they have 103 full-time staff equivalents on site, on any shift, on any day, 365, providing care. This is about where some of those hours misclassified as productive when they were unproductive, or were some of the hours classified as unproductive when they actually were productive. Not as much about the cost issue, if that helps.
Oh, it makes sense, but
We still need to get it right and accurate, and then our job needs to be to verify with some level of direct evidence is what we're being paid, or is what being counted correct? That's on us, and we haven't done a good job doing that.
Ms. Cora?
Because as we already indicated, the first objective was, verifying that the actual expenditure taken. We already, based on our audit, we're not sure of what we pay for, because we don't confirm our actual costs. So what we were trying to do on this objective is, okay, let's try and see if we're actually meeting the number of hours that is required in the contract for the services we perform. So that's what looking at, that's why we're only concentrating on the hours rather than the economic side, because this was very confirmed, we don't know what the actual costs were by confirmation, but we wanted to make sure at least we had the number of hours we needed, which was the 103.6 of productive, or 118 total hours.
Commissioner Webb? I'm
Yeah,
sorry.
to that point, thank you. So did you get there?
That's what we're getting to right now.
Okay, and then to me, the economics are still important. Once you pointed these things out in this audit, as part of the corrective action plan, to have them go back and ensure that the economics are appropriate, not only as far as paying individuals, but as far as their contractual agreement with the county?
Because that would be part of the verification of actual costs. Personnel costs will be part of the total costs,
So we will
the
know.
largest part of the total cost.
So once this is revealed and it's going to be put in the corrective action plan, that they retroactively resolve that? I mean, are they going back, or are they just going forward?
As far as the issue of the classifying in the system, that's something we'll have to meet with CCS, because it's our opinion that maybe it might not even only be a county issue, it could be an entire CCS issue.
Yeah, but we only care about how it affects us. I mean, I don't
Right,
mean to
no, but I'm
sound-
saying, because if you're misclassifying, you're probably
Right.
misclassifying for more than just us.
Well, and that could be, but if they're falling short of a contract obligation, then we need to make sure that they shore that up economically and procedurally so that it doesn't continue.
Right, and we're going to have another slide where we show where we took the total hours and compared it to the contract as far as the number of actual service hours provided to the county.
Okay,
Yeah.
thank you. All right.
Commissioner Bidoon.
Thank you, Mr. Chairman. I have a quick question. When the original contract, obviously I wasn't on the commission last year, or when the contract was awarded. When the contract was awarded to CCS, what parts of that contract do we call for specific information to be provided on a monthly basis or quarterly basis in order to verify that they're complying with the terms of the contract? I mean, would you say that there was a specific percentage of this contract we really need to pay attention, especially payroll? That's where you would have a lot of abuse in terms of payroll. So I'm not sure. I haven't seen the contract, but I'm not sure what parts of that contract do we call for stricter verification, if you will.
Can I jump in there on that one? What I heard him say was there was a lack of accountability both ways. So there actually was people that were working that could have been not working, and people that were not working that were working. And then going forward, there is more accountability relative to the swipe system. So if I'm hearing something different than that, if somebody could clarify.
I think to answer that, there's provisions in the contract where you required reports to be provided, but I don't know if the reports that were needed to be provided for the contract would have got to the point where we are today. If you had to provide a monthly summary report of the FTEs, we received the monthly summary report of the FTEs that showed the actual hours that were put in based on CCS, and they compared it to what the budget's hours were. But from an audit perspective, we can't take a one-page summary report and say, this is your total number of hours, and be assured that that's the hours that were actually provided. That's why we're asking that we think more additional information needs to be provided so that there's something that stands behind that report. So if you got a report that's showing you put in 103.6 hours of actual time, we need to see some timesheets submitted to the county that rolls up the actual number to that summary report. And I think the contract probably didn't have that kind of detail, because I don't know if contracts go into that detail, but I think it's from a process point of view, you would want to see that information so that you can confirm what you're getting. And that's why we said the contract may have said provide true-up invoices on a yearly basis or a quarterly basis, but from a process point of view on the county, as far as the oversight, you would want to go a step further. Okay, show me what you have that can get me to your report that you provided. So I think it's just more processes that need to be put in place so you have a better understanding of what you actually have rather than just a report.
Can I elaborate more on that?
Sure.
And I would admit, initially when the OAG brought this up, I pushed back a little strong. But as the OAG office just explained, the type of contract, we end up learning a bigger lesson to what Ms. Cror just spoke on. When they let us know that this was a cost-plus program, we had to show some integrity in the process. But looking at it from a broader standpoint, it showed that we need to look at all of our systems in dealing with some more financial control. So I mentioned that in the state that me and Mr. Brooks have been talking, at least for the last 6 months, on how to handle this. Because mind you, and I think Mr. Dubé brought it up earlier, the county got antiquated accounting system, so forth and so on. We're lacking staff. So the question is, how do we bring some integrity to the system, to something we didn't expect? You know, because we outsourced a major part of this. So if you outsource, that means you reduce staff. But now we have the responsibility to do more oversight. So how do you balance this? So again, me and Mr. Brooks is talking and we're coming up with some ideas, but how do you fund it? That's a different discussion, but I think we got our finger on it and we should come up with something to fund it. So what we're looking at is not just solving this CCS issue, which, for lack of a better term, was a blessing because it brought up broader issues overall. So we want to look more broadly on how to resolve this.
Well, and to your point, actually, we got budget coming up, our budget year's in October. It's my understanding that the auditor spent close to, 2,000 hours on this? So, I mean, it's not like, again, if you're looking at the broader perspective, it's like if we do fund someone to make sure that the procedures are correct, the numbers are correct, then actually we're not spending extra money, we're spending less money because when the auditors go in the next time, it costs us less.
Correct.
So, and also, I've got a line of folks here, Commissioner Clark-Coleman.
Yeah, I just wanted to say that when you talked about not having the budget to fund it, I guess my response to that is that if you hired 2 or 3 people and that was their focus, that was their one focus is overseeing that, then that would pay for it, for those people.
You still in our thunder, correct? That's what we're looking at.
Yeah, see, because if you,
Right.
so if you find the money or use the money, because I'm sure you can find the money,
Correct.
go ahead and pay that money, then you will recoup it in savings that those people, say you hire 3 people, and their one focus is just that, then you'll find that you will recoup that plus more.
Correct.
And just so the commission's aware, we did add resources in the upcoming budget that's been was part of our budget submission, and at least to date approved so far. I know it's not finally approved, to do exactly that. So we have new resources that we've already started drafting job descriptions, even though they wouldn't come online till October 1, so that we can be very ready October 1 to hire these positions and be able to do a better job at verifying the information that's being processed through the contract.
So we're rolling in the same direction. Marcy?
I hope I answered your question, Commissioner, because it's, like I said, the contract did have requirements for reports. The reports were submitted, but I think it's more of the process and verification of those reports to make sure we're actually getting what we should.
Okay. You all set, Commissioner Bedo? You all set? Thank you. Okay, moving right along.
Okay, now we're on, this is, the CCS used two staffing agencies for nurses, and what we found is, as they indicated, sometimes the agency nurses were swiping through the Kronos system and sometimes they weren't. So when we did the summary report from CCS, we noticed that 2 individual nurses, hours were recorded under their area where they would have swiped their timesheet. Then there was hours also recorded where they were invoiced to the county on an invoice. So our concern is that these 2 agency nurses' hours may have been counted twice into the productive hours. So that's been rectified because now going forward, all agency nurses are required to swipe through the Kronos system. Next, this is just based on our reconciliation of the actual timesheets to the summary report from CCS. We noticed that we had some hours for the timesheets had more hours than what was recorded on the summary report. We also had some where the summary report had more hours than what was recorded on the timesheet. So there just needs to be some type of reconciliation so that the timesheets match the summary report. We found that sometimes it went up and sometimes it went down, so it wasn't always in one direction. This goes back to our table. Well, we don't have the table here. There's a table in the report, but we took, after we did a calculation of the FTEs that was based on our analysis of the timesheets. This is where we classified the hours that should be actually charged productive and those should be non-productive. So this was based on our hours recalculated, and we determined there was 93.46 of productive hours and 13.43 of non-productive hours for a total of 106.89. Now, the 93.46 would be compared to the contract requirement of 103.6, and then the 106.89 would be versus the required contract of 118.9. So in this instance, CCS was not in compliance with the contract requirement. And what's important to realize too is there is penalties to the contractors so when they're not in compliance. So something that the county may need to do is go back through the summary reports, make sure that where they weren't in compliance, that we're making sure that there was any penalties due to the county, they are done. Then also, but this is also based on because of how the hours were misclassified. So that's why our number is different than what CCS is.
Yeah, we're not going to finish this engagement today, so I'm not going to rush through this. This is actually going to take another day. So if I may, why don't we move forward? Is there a motion to pass for the day? Nope.
So moved.
Is there support?
Sure.
Ms. Cora? Under discussion, Ms. Cora?
Could we just do one more slide, because then it kind of ties into the same one objective, then we'd be done with this one objective.
Okay, on this one objective, is it okay if we, okay, go ahead.
And this just has to do with the pool nurses. These are the nurses that are coming through the agency. The way the contract is set up, that these, the agency nurses were a temporary solution to permanent positions being filled. They should not exceed 30 days. We found based on our analysis that there was 2 agency nurses appeared that they were being used for more than 30 days. So I think the determination needs to be made if these agency nurses are required for, maybe for consistency purposes for nurses in the jail, there is a not compliance with the contract regarding the 30 days.
Does management agree?
With what she just recommended? Yes. Yes, we do.
Okay, we're rowing in the same direction. That's a good thing.
That would end the staffing analysis piece.
Thank you. And there was a motion to pass for the day by Commissioner Clark Coleman.
Yes.
And there was support
Yes.
from Commissioner Tom. And then any further discussion?
Sir?
Ms. Cora?
I just want to add, when we get into the rest of the engagement procedures, we're getting into more of where we're looking at the clinical side, the timeliness of services, things like that. So I think them are important features. And that's where we get into the key performance indicators also.
Thank you. So all those in favor of passing for the day, say aye.
Aye.
All those opposed? The ayes have it. Next item, Mr. Clerk.
Item E, such other matters as may be properly submitted before the committee.
There are none.
Item F, public comments.
Is there anybody from the public who would like to comment? Mr. Johnson? Podium. This podium on, the mic on. Welcome. Good. Your mic's on, I can hear you. Yeah.
I was calling concern, we have like the dogs in our neighborhood. And I call it the busing, and I call the animal control too, because we got the dogs real bad over where I live at. I live right there on Wilshire and Gus on Detroit East Side. They be down that way, and they on Wilshire and Carnage too. I think we might have the same problem like they had in Southwest Detroit, because these dogs, they really, it's the pet bulldog dogs. Dogs, they're real bad. And they closed down the Dollar Tree up there on Kearns and Gratiot. The Dollar Tree, dollars. We go to the one on East One and Kearns now, across from the Turkey Fried Chicken.
As a point of information, we don't respond back and forth to under folks that want to comment, but there are commissioners here from the city of Detroit that probably would like to get your information after this meeting, but we don't go back and forth on your comments. Your commissioner's back here in the corner. So, but anyway, we won't go back and forth. But would you like to? You got more stuff to say?
It was tearing down that building over there, that school, because it was abandoned. They turned it down, building down over there, all permanent and grass. We need like a green light in our centers too, like the recreation, like some safety for the staff and stuff too. City Shore Parks and Recreation, like, I think it should be like in front of the building and back of the building too. Like for the recreation centers like in Detroit. Somewhere at Coleman, on the locker room too.
Okay.
That's all. Thank you.
Okay, thank you. Does anybody else would like to comment from the public? Brian, you got anything to say? Anybody else from the public like to comment? Anybody else like to comment? Okay. Next item, Mr. Clerk.
Item G, adjournment.
So moved.
It's been moved and supported. All those in favor?
Aye.
All those opposed? The ayes have it. We are adjourned. Thank you.